At 10 this evening on Friday, the CDC broadened the list of underlying conditions that could be affected by and/or cause more complications if affected by COVID-19. Ileana Capion joins us live in studio to tell us more. Ileana, good evening.
Good evening, Paige. Not only has the CDC released new guidances, but they have added new symptoms for COVID-19 as well, including diarrhea and stuffy or runny nose. But Southeast Health Dr. Justin Hovey says another list was also released, a list no city should want to be a part of. But unfortunately, Dothan has made its way to the top 50 of this list.
The new guidelines from the CDC that were recently released, particularly I want people to focus on the new symptoms that have been added, particularly diarrhea, and it's actually been a symptom that we've seen a little more often.
Hovey has seen patients with diarrheal illnesses as a symptom, and half of those patients ended up testing positive for the virus. Along with the new symptoms, the CDC also removed the age threshold for those who can be affected by COVID-19.
So we're seeing it from children all the way up until, geriatric age. But even some of the healthy younger people that we see are getting very ill from the virus itself.
Obesity, hypertension, and type 1 and type 2 diabetes all have the possibility of a worse outcome from COVID-19. But thought has shifted from COVID being seen as a respiratory illness to a vascular disease.
Diabetes in general is what we call a vascular disease. And the way that we're starting to look at this virus now is that we're looking at it kind of from the perspective of it being a vascular virus. So meaning affecting blood vessels and affecting all types of organs.
Above all, Hovey wants people to realize this is a real health issue and not a political hoax. He says we have lost more people in the past 4 months than we did in the Korean and Vietnam War combined.
I do not see people wearing masks or taking the precautions that are necessary, and that is why Dothan is number 48 now in the number of cities in the United States with the fastest rate of rise of COVID. So we need to take this seriously in the community right now because things are about to go from bad to worse.
Dr. Hovey says we are still in the first wave of the pandemic, and this is not yet the second wave of COVID-19. He fears that there will be an overlap between the two waves if people do not begin wearing their masks and adhering to social distancing guidelines. Paige, back to you.
Thank you very much, Ileana. Definitely a story we will continue watching and covering.